Hello everyone, a very warm good morning to everyone here. Welcome to today's Apollo Cradle session on fibroid causes. We would like to welcome Dr. Snigdha, our in-house obstetrician and gynecologist. She holds a degree in MBBS, MS and FEMAS. Doctor, a very good morning and welcome to you, Doctor. You can take it
Good
forward from here,
morning.
Doctor.
Yeah. Hello, everyone. Good morning. This is Dr. Snigdha. We are here with Apollo Cradle to talk about the most common condition which is affecting most of the women these days. That is fibroid uterus. Fibroids are, as we know, fibroids are the benign condition. That is, they are non-cancerous. Usually, 99% of fibroids are non-cancerous, and it is very rare for them to become a malignant tumor. These fibroids, hello Chatura, can you hear me? Hello,
Hello.
Chatura, you.
Yes, Doctor. We can hear you, Doctor.
Okay, thank you. Uh, as we know, these fibroids are, as I'm telling you, these are benign tumors, and they usually affect women in the reproductive age group, that is in between the age of 30 to 50. We take almost like 25 to 50. Uh, According to the studies, what we see, almost 50% of the women population do get affected with the fibroids. But out of the 50% population, only 10 to 20% would present with symptoms. So coming to the symptoms of fibroid, fibroids are usually asymptomatic in most of women, as I've told you, and only 10 to 20% of women have the symptoms of fibroids, like heavy menstrual bleeding, and some may present with complaints of pain during menstruation or continuous spotting throughout the month, or in between, like spotting in between the cycle for the 2 to 3 days or more than that. Or sometimes the period may last for only 5 days, but it may be a very heavy bleeding. That is, sometimes we see patients changing pads every 1 hour also, and or their menstrual cycle may last up to 10 to 15 days. Besides from heavy menstrual bleeding, the patients usually complain of pain sometimes, and they have, because of some patients couldn't recognize the heavy bleeding because they can't differentiate between the heavy bleeding and the normal bleeding, and they usually come with the symptoms of anemia like breathlessness or tiredness, or they are not able to do their daily chores. Or sometimes the patient may present with pains like the lower limb pains, which we usually call as sciatica, which is, these are called as pressure symptoms. That is the fibroids pressing upon the sciatic nerve, leading to the pressure pain of the lower limbs. Or the urinary symptoms, like the patient, the fibroids will press upon the urinary bladder, and that will lead to incomplete emptying of the urine, or there will be increased frequency of urine. Or sometimes the patient may usually present with constipation also. So when the women come with these symptoms, we usually try to go through their history and all, and then evaluate accordingly. As I've told you, some women are asymptomatic. So for these women, fibroids will be, as a, when they have their regular gynecological checkup, they'll be diagnosed unexpectedly in their routine ultrasound examination. So, coming to the diagnosis of the fibroid uterus, fibroids are, as I told you, usually diagnosed unexpectedly during their routine gynecological examination. Or if the patient comes with the symptoms of fibroid, we order for an ultrasound examination, ultrasound pelvis and abdomen, and we check for the fibroids. Or sometimes the fibroids will be very large that we can able to feel a mass on their abdomen. That is, we will be able to feel the part of the fibroid, like we'll be able to feel with our hand. And coming to the sizes of the fibroids, sometimes fibroids will be as small as 3 centimeters to as large as the size of a football also. That is around 20, extending from 3 centimeters to about 20 to 25 centimeters on the abdomen. So, coming to the, like, diagnosis, there, after the diagnosis we try to differentiate like which kind or type of fibroid the woman is having. See, the fibroids are nothing but the smooth muscle cells, which multiply in order to form a mass. That is called as a fibroid. So there are different kinds of fibroids, as we call. They are subserosal, submucosal, or pedunculated fibroids. Pedunculated fibroids are usually subserosal, that is, they'll be protruding out of the uterus. Like we can see them on the uterus directly, either in an ultrasound or during a direct visual examination. And intramural fibroids are something that which protrude into the cavity of the uterus, and sometimes the fibroids may be in the musculature of the uterus also. So depending on the position of the uterus, the symptoms may also vary. If the fibroids are large enough to occupy the cavity of the uterus and then the treatment is different. And if the fibroid is pedunculated, that is protruding outside the uterus, the treatment is different. So, depending on the site and size of the fibroid, also we change the modality of the treatment. Now, coming if the woman coming to the treatment of the fibroid, if the woman presents, like if a woman is have already completed her family life, that is, she's already having two children, and she's she doesn't want to preserve her uterus or something like that, then the main modality of the treatment is hysterectomy, that is a surgical treatment. Uh, all over India, the most common cause for hysterectomies is because of fibroid uterus. So, if
Hi, doctor. Sorry, there is a question. So
yeah,
they ask that what are the prime indicators of having fibroids? Like, how can one know that that I might have fibroids?
see, as I've told you, most of the fibroids are asymptomatic. So, women usually doesn't know that they'll be having fibroids on in their uterus. So, it is advisable after 30 years of age you go for routine gynecological examination every year. So which includes a pap smear examination and ultrasound pelvis. So we may identify the fibroids in the pelvis, in the pelvic scan. Or else, if the woman is having heavy menstrual bleeding, or heavy pain during menstruation, or if it's a reproductive age group, that is, if they are planning to conceive and they are having recurrent abortions, then we can suspect that women would be having a fibroid uterus. Or if they are having, as I've told you, pressure symptoms, that is, they are not able to void their urine completely, or if they are having heavy constipation, then also we can suspect a large fibroid in the uterus. So it depends.
All right.
It's not like they can identify it at home. They have to get an ultrasound examination, and then we'll find out how, like, where is the fibroid and all. I
Okay.
think it's
So
important.
also another question, doctor, is that during if is it that most of the women, if they get miscarriages, frequently miscarriages, if they
Yeah, yeah.
miscarry a baby, so is it because it might be they might have fibroids, or that is not necessarily the case?
No, no, that is not necessary that the woman should be having fibroid if she's having recurrent miscarriages.
Okay.
Uh, if the fibroid should be large enough to cause miscarriage. That is, it should be entering into the uterus, which is not helping the embryo to get implanted. So it is, yeah, fibroid is a cause of miscarriage, but it should not be the primary cause for the miscarriages to happen.
Primary
There
cause.
are many other causes also for the miscarriages to happen, but it is one of the cause.
All right, sure, no problem, doctor. So you were talking about the treatment plan. Sorry.
Yeah, I'm going to talk about the treatment plans right now. So, as I've told you, the treatment varies depending on the symptoms of the patients and depending on the future plan of the patient and her age group also. If the patient has completed her family life and she doesn't want to have any more children, then we go for as I've told you, for the surgical management of the fibroid uterus. Most of the hysterectomies are because of the fibroid uterus in India. Not in India, all of the world. The most common cause for hysterectomies is fibroid uterus. But in case if the patient wants to, conserve her uterus and she doesn't want to get remove her uterus, so we go for primary medical management of the fibroid also, where we use certain kind of drugs to decrease the size of the fibroid. But the main problem with medical management is the fibroid size usually comes back to its original size once we stop the medication. Coming to the symptomatic treatment, that is, if the patient presents with either heavy menstrual bleeding or pain during the cycles or something else, then something in sense the pressure symptoms and all, the treatment varies. Mainly for the bleeding, the heavy menstrual bleeding is the main cause for the people to come to our OPDs. So to correct the menstrual bleeding, we usually start off with hormonal changes, hormonal tablets. Sorry. So the hormonal tablets could be progesterones or combined oral contraceptive pills, or the painkillers also, and even the tranexamic acid, which will help in reduction of the bleeding. But as I've told you, the patient wants to have children. We can't use oral contraceptive pills on them because it will also give the effect of contraception in those women. So depending on the history of the patient and the will of the patient, the treatment varies. If the patient has completed her family life, then we usually suggest her something called as Merina, that is intrauterine contraceptive device with the progesterone, with the hormone called progesterone in it, which will also help in reducing the bleeding. The patient will have very good symptomatic relief with Merina, but the problem is they can't have pregnancy with an intrauterine contraceptive device. If they want to have a pregnancy, then we would check for the size of the fibroid. If the fibroid is more than 6 to 7 centimeters and it is causing symptoms, then we will usually ask for the ask the patient to undergo myomectomy, that is removal of the only fibroid itself, not the uterus. Only the fibroid will be removed, and they can plan pregnancy after 3 to 4 months of their myomectomy. So myomectomies can be done in different ways. It can be an open myomectomy, that is, we cut open the abdomen and we remove the fibroids, or it can be a laparoscopic myomectomy or a hysteroscopic myomectomy. We usually suggest a laparoscopic myomectomy because patient wants to get pregnant afterwards also. So we usually don't want to open her abdomen. We just want to put a port, that is a small hole in the abdomen, and remove the fibroid. And coming to hysteroscopic myomectomies are done if the patient is having a fibroid in the uterine cavity. That is, we put a camera inside the uterus through the vaginal approach, and we remove whatever the fibroid is there inside the uterus. It See, the pedunculated or the fibroids which are on the abdomen cannot be removed on the uterus, like outer surface of the uterus cannot be removed with the help of hysteroscopic myomectomy. Only the fibroids occupying the uterine cavity can be removed with the help of hysteroscopic myomectomies. And so after all these procedures, like any kind of myomectomy, either be a laparoscopy or an open myomectomy or hysteroscopy, the patient is supposed to wait for 3 to 4 months to get pregnant or to plan her pregnancy, so that the sutures what we have put on the uterus will get healed properly. And coming to the hysterectomy, that is, if the patient has completed her family life and she doesn't want to conserve her uterus, then we can go for hysterectomy. The hysterectomy, again, as I've told you, depending on the size of the uterus. That is, if the fibroids are very large, like around 10 to 12 centimeters or more than 8 to 15 centimeters, it's better to perform an open hysterectomy. That is, we cut open the abdomen, because such a large fibroid removing through a small hole is a difficult process in laparoscopy. So if the size of the fibroid is very large, we suggest an open hysterectomy. Or if the size of the fibroid is below 10 centimeters, we can always go for a laparoscopic hysterectomy. And this is for the women who have completed their family and who doesn't want to preserve their uterus. If they want to preserve their uterus, as I've told you, myomectomy is an option. Or there are other procedures like uterine artery embolization, where we do embolize the bilateral uterine arteries, and so that the blood supply to the fibroid will come down, and the size of the fibroid will definitely come down. But it is usually contraindicated in women who wants to plan for the future pregnancy, because sometimes the decreased supply to the uterus may also lead to, if they get pregnant, the blood supply to the uterus will be less, and there can be recurrent miscarriages, and there can also be some intrauterine growth restriction for the baby also. And there is other special we see some special cases, like women get pregnant with the fibroid uterus, like they will not have any clue that they will be having a fibroid in their in their whole life, and they get pregnant and they come to us, and when we do an routine ultrasound examination for the pregnancy, we get to see that there are large fibroids around 6 to 7 centimeters, and sometimes there can be multiple fibroids. So we come across such kind of people also, where we need to tackle both the fibroid and the pregnancy at a time. So if you're pregnant with a fibroid in your uterus, there can always be a chances of, as I've told you, recurrent pregnancy loss, and there can be, the bleeding in the first 3 to 4 months of your pregnancy, or you may have pain during your pregnancy, because pregnancy hormones will lead to a condition called red degeneration, where the fibroid will be becoming very fragile, and that will lead to a constant pain during pregnancy. And you may have preterm delivery, that is, your fibroid is so big that your uterus is not able to enlarge to accommodate a fetus, and it will try to push out the baby before 9 months of your pregnancy. So you may have to tackle with that, or you can have, the water may break very early, that is around in 7th or 8th month you may come with the water breakage because of the fibroid uterus. Or there can always be, if the fibroid is occupying the upper part of your uterus, your placenta may come and settle in the lower part of the uterus, what we call as placenta previa. And sometimes because of your the previous heavy menstrual bleeding, you may present with severe anemia in your pregnancy, where we have to transfuse blood in order to continue our pregnancy and maintain a healthy pregnancy. So all these are the complications which we have to tackle if you get pregnant with the fibroid in situ. So even the delivery process would be very difficult if if you have a large fibroids during pregnancy. We usually can't go for a normal vaginal delivery, because as such your uterus is very large with the fibroid, and your baby within the uterus. So the normal delivery process would be very difficult. Most of the people with fibroid uterus may land up in cesarean section. And if you have a previous history of myomectomy, that is, you got your fibroid removed and you plan your pregnancy, you got pregnant, then also we usually don't attempt for a normal vaginal delivery, because the previous myomectomy scar which you have on your uterus may give away that it would have opened. So we usually go for a planned cesarean section for the people who have had a myomectomy in the past. And if the patient is very particular that she wants to conserve her uterus and she can't go for a hysterectomy, then sometimes we combine both medical and surgical management. There are few drugs which decrease the size of the uterus, like ulipristal and other drugs, which we give preoperatively for 2 to 3 months, so that the size of the uterus would have come down and the vascularity, that is, the blood supply to the uterus, would have come down. And we plan for the hysterectomy, so that the procedure of the and we plan for the myomectomy, so that the bleeding will be very less during the surgery in the process of myomectomy. Or sometimes we come across the cases where the size of the uterus will be the size of the fibroid may be around 15 to 20 centimeters, and there will be multiple fibroids like that. In that case also we combine both medical and surgical management. That is, we start off with medical management for the first 3 months, and then we plan a hysterectomy for such kind of patients. So the fibroid management usually depends on on the history of the patient, on the requirements of the patient, and whether to continue her fertility period or not. I hope I'm clear. If you have any questions, you can please ask.
Yeah, hi doctor. Yes, we do have few questions. So you told hormonal therapy, right? One of the user asked, what are the side effects? Sorry, doctor, you're on mute. Hello, doctor, can you hear me? Yeah, yeah, now I can hear you. So you were talking about hormonal therapy. So one of the audience asked, what are the side effects of these hormonal therapy?
Coming to the hormonal therapy, because as I've told you, the hormones what we usually use are the progesterones to hold your bleeding. The usually side effects of progesterones are weight gain and your mood swings. These two are the most common side effects, which are manageable. It is not like very high mood swings or very massive weight gain or something like that. But those two are the side effects of the progesterone. Coming to oral contraceptive pills, we are using a very low dose oral contraceptive pills, which should usually not cause any side effects. But the main problem is you can't use them in women who are planning their pregnancy. And coming to other medical managements we give, usually most of them will not have any side effects, except for one drug, that is DNRH analogs, which we use to reduce the size of the fibroid, will lead to osteoporosis in future. That is, your you may have joint pains in future. Other than that, not major side effects are seen with the drugs.
Okay. And you also said that one of the audience asked that you said the fibroids sometimes come back in the original size, the same size that they were in before. So is it a
Yes.
recurring thing? Fibroid keeps recurring even after the procedure?
Yeah, fibroids are recurrent. We never know.
Okay.
If we remove the fibroids also, the women may present with fibroid again after 5 years. We can never completely say that fibroids will never come back. Fibroids may come back also. We don't know. And as I've told you, when we give medical management, the size usually shrinks. That is, if the woman is having a 5 centimeter fibroid, it may come down to 3 centimeters. But once you stop your medical management for 2 to 3 months at a stretch, it may again come back to 5 centimeters. So there is every chance for recurrence and also increase in size after stoppage of medical management.
Right, doctor. So one more question is that, doctor, so when you're diagnosed with the fibroids and then you go under a procedure, you go under a treatment for it, and it becomes all right for the time being. Is there any lifestyle changes needed for the person, for the patient, to make sure or try their best for the fibroids to not recur again?
Not major because fibroids are usually not associated with lifestyle. So
Okay.
what we usually tell to the women is decrease in the salt content. They have to reduce their salt content, the amount of salt they are taking, and maintain good hydration and go on a regular exercise workout. I mean, regular basic workouts so that it will maintain. But there is no proven result that lifestyle modifications will not help in recurrence of the fibroids. Fibroids are basically, yeah, fibroids are genetic also. That is your mother or your sister or any of your paternal or maternal aunts having fibroids also. That would affect you in few. That could affect not everyone, but few people. There is also a genetic predisposition
So it
for.
is a disease associated with hereditary, is it,
Yeah,
doctor?
yeah.
Like,
It is
if chances are that it might. And you
yes,
said
yes,
that there are very less chances for it to for it to be cancerous. So
yes.
in
It is
case
very
if that will,
rare for a fibroid to become cancerous. There is only a chance of 1% for a fibroid to get converted into a cancerous mass. Otherwise, it is very rare we see fibroids turning into cancerous masses.
all right, doctor. Yes. So last question is, doctor. So is surgery needed for as such, or in case if it's a small thing, is it like dissolved through these? Is the fibroid dissolved, or it can only remove through surgery?
As I've told you, depending on the size and symptoms of the fibroid, we plan the treatment. If
Okay.
the patient is asymptomatic, like if she's having, let us consider if she's having a 4 centimeter or 5 centimeter fibroid, and she's completely asymptomatic and she's not having any problem with her menstruation or her family is complete and she's like not any other symptoms like pain and all, we usually leave it. We don't have to treat it medically or surgically either in both the ways. If the patient is having if the patient is presenting us to with a symptom something like that, and we if she's in reproductive age group, a 35-year-old woman presenting to us with the heavy bleeding period, then we usually go for a medical management. We don't want to remove her uterus as such. If a 45-year-old
Okay.
comes with a heavy menstrual period, yeah, we suggest a hysterectomy. But 35-year-old, we try with the medical management. If even with the medical management, her symptoms are not coming down, and it is it is affecting her lifestyle, it is causing other problems like anemia and all, then we suggest a hysterectomy. Otherwise, we do not.
All right, sure. Thank you, doctor. So, any last words, doctor? Would you like to give any other?
Yeah, I would tell every woman, as I told you, above 30 and above 30, get your gynecological examination done every year, including a pap smear and your routine ultrasound examination. And don't panic if you happen to find a fibroid in your uterus in your routine ultrasound examination, because fibroids are usually non-cancerous. Talk to your gynecologist. Nothing is going to happen, and just follow up with your scans every year.
Okay. Thank you so much, doctor. The session has been so informative. You've been patient in
Thank you.
explaining all the questions from the patients and on the live. So we're looking forward to having you on more of our, more on the fibroid topics in the future.
Yeah, sure. Very. Thank you.
Thank you, doctor.
Thank you.